Most of us treat foot problems like dry skin or swelling as isolated issues. But if we follow the internal plumbing down to the floor, those persistent complaints at the end of our legs serve as a visible readout for the health of our central organs. To be clear, physical signs in the feet are not a substitute for a medical diagnosis. You should always see a doctor for formal tests. However, these indicators provide early insights into functional congestion within the liver. In this circulatory loop, the heart pushes blood down to your toes, then forces it back up against gravity. But if your main filter, the liver, becomes congested, that upward flow slows. The fluid has nowhere to go, pooling rapidly at the lowest points. Because our feet sit at the very end of this long anti-gravity pipeline, they represent the weakest link in our circulatory chain. That makes them the body's primary early warning system for central organ failures. One of the first physical signals of a struggling pipeline appears right on the surface of the lower leg, tiny, shiny red or brown specks. When circulation deteriorates and blood struggles to climb back up to the torso, the microvessels in the skin become starved and discolored. As the pressure builds, those tiny spots often graduate into a more obvious structural failure known as a spider nevus. These are visible, web-like clusters of damaged veins pushing up against the surface of the skin. These spider veins indicate that the liver is failing to filter hormones. We see this frequently in severe conditions like cirrhosis, where the liver loses its ability to clear estrogen out of the blood. When that unfiltered estrogen accumulates and recirculates, it damages the vascular system walls. The excess hormone breaks down the structural integrity of the vessels, causing them to physically dilate, branch out, and distend on your calves and ankles. These cosmetic blemishes on your legs provide visual proof of chemical processing failures happening inside your abdomen. Further down the foot, cracked heels signal a systemic nutritional deficit. While often dismissed as simple dryness, chronic cracking suggests the body is lacking vitamin B3 or omega-3 fatty acids. To understand why, look at this abstract diagram of the liver's production cycle. A healthy liver constantly manufactures a fluid called bile, which acts as a chemical detergent. This bile is strictly required to envelop and dissolve fat-soluble nutrients like vitamins A and E, making them accessible to the body. If the liver gets sluggish and stops producing enough bile, that absorption process halts entirely. The fats and vitamins pass through the digestive tract without being absorbed. The outer tissues of your body, like the thick skin on your heels, are systematically starved of the structural oils they need to stay intact. External lotions and moisturizers only address the symptom. Without restoring the liver's ability to process these fats, the tissue will continue to fracture from the inside out. As liver congestion worsens, the feet often become hot, relentlessly itchy, and prone to bad odor. This happens when backed-up bile forces an excess of histamines into the bloodstream, triggering burning inflammation in the soles, a condition often mistaken for plantar fasciitis. At this stage of congestion, your body enters a state of triage. With your primary filtration systems, the liver, the kidneys, and the colon, clogged with metabolic waste, the body desperately attempts to offload toxins through the skin of the feet. This systemic backup destroys the microflora valence in your gut. With your internal defenses compromised, the toxic environment at the extremities allows pathogens like toenail fungus to thrive and multiply. We also see this massive internal backlog manifest as pitting edema. When pressing firmly into the lower leg leaves a physical dent frozen in the skin, it proves internal fluid is physically trapped in the tissue, rather than being a case of local fat or muscle gain. Chronic foot odor, stubborn fungal infections, and deep fluid retention are the physical consequences of a filtration network that has effectively collapsed. If the symptoms at the bottom of the body are triggered by a broken filter at the top, we have to identify what causes the liver to reach this state of failure. The breakdown begins with heavy chemical stressors. The long-term use of medications and excessive alcohol intake forces the liver to work constantly to clear out toxic compounds. Looking at this central filtration funnel, dietary stressors compound the problem. High fructose corn syrup and pasteurized foods lack enzymes to keep the liver clear, overloading the funnel. Excessive protein further builds nitrogen waste, overwhelming the liver and kidneys' capacity to clean the bloodstream. A highly processed diet essentially suffocates the liver's cellular machinery. Once that machinery stops turning, the pressure drops down the circulatory pipeline, resulting in the foot symptoms we've tracked. To reverse the congestion, you must first stop the damage at the source. This requires lowering your protein intake and massively increasing your consumption of raw, uncooked vegetables. Raw vegetables provide the live enzymes and antioxidants needed to flush built-up waste. These nutrients act as the primary tools for clearing out the nitrogen overload and restoring the liver's natural rhythm. To optimize this healing state, the most effective protocol is a combination of a healthy ketogenic diet and intermittent fasting. Locking these two strategies together gives the liver the extended digestive breaks it needs to clear the backlog. By correcting the chemical input at the top of the system, the central filter can finally heal. Once normal flow is restored, the warning lights on your feet will naturally turn themselves off.